is very, it is very gratifying when we reverse the LV dysfunction for any clinician or interventionist or anyone with anything intervening and reversing the heart failure or almost an end stage disease. So I will just share one of our cases and our case series, very unusual but in this part of the country, but very common cause of suicide in the northern part of country, particularly among farmers. And in northern India, the alphos poisoning, the rodent poison, is one of the most common cause of suicidal deaths. And we all know that once we must have seen in our residency or in emergency, whenever we used to find these young people with an hypotension and not responding to inotropes, we all knew as a young mind that these patients are not going to survive because the death was almost 100%. So if it is, the basic mechanism is the phosphine gas, which we all know that after exposure to moisture or in the stomach acids, it inhibits the oxidative phosphorylation. I'm not going into detail, but it can affect all the systems and leading on to cellular injury, and maximum brunt is borne by the heart. And glutathione, which is protective, is being used by this. So the cardiac involvement is imminent in the form of left ventricular dysfunction and increased size of the ventricle, subsequently leading into decreased cardiac output, hypertension, and so on and so forth, with the number of peculiar arrhythmias, right from atrial fibrillation to ventricle tachycardia, ventricle fibrillation, leading to sudden deaths or slow death in some of the patients. Unfortunately, the patient is conscious. So this is how it behaves differently. It can cause a direct toxicity on the cardiac myocytes, which causes suppression of the myocardial functions. It can act through cytochrome C, as I have already explained. And then is another way of phosphine gas effective on the adrenal gland, and it causes circulatory failure. And this is one of the most dangerous thing. But most of the time we find a combination of these two, myocardial inhibition and a circulatory failure. And then there are many conservative treatments for that, but we know that if patient comes in first few hours, first 1 hour or 2 hours, then these conservative mechanisms can reduce the mortality to some extent. But once, as in most of the cases, the patient comes very late to us, and by the time the damage has been done, so these conservative mechanisms in the form of fluids, through CVFP guided things, IABP or ventilatory support, or magnesium, most of the time it is a failure. And we know that once the patient comes with a severe hypotension and a metabolic acidosis, majority of the people, they don't survive. So we were thinking on those lines, and in my residency I have seen hundreds of patients dying, young patients dying. So just 4 or 5 years back, in 2013, we got a patient from a medicine department who is a young farmer who was brought in an emergency room 7 hours after ingestion of 2 alphos poisonings. And typically any resident who have dealt with alphos poisoning, right from the smell they can diagnose that it is alphos, and some of them they confirm with the silver nitrate test to confirm that. The patient was very sick. We can see that with the tachycardia, blood pressure low, on inotropes, oxygen saturation was low, ABGs were quite bad with a pH of 6.9. This is a typical ECG, one of the ECGs, which shows all sorts of broad complexes, tachycardia, conduction defect, depicting either it is a myocardial involvement and conduction involvement. The patient was put on mechanical ventilation. Lavage was done. We knew that but it has to be done, and patient was started on high dose of inotropes. So repeated patient was having ventricular tachycardia. So this was the echo of this patient. Very clearly we can see that the LV is hardly moving. So patient had a severe LV dysfunction. I would say it's less than 20% metabolic acidosis, refractory shock. What to do? Our previous experience is that none of the patient survive with this type of a combination, and all of you must be agree. So what are the options? We thought of, till then there was no report of using ECMO on alphos poisoning in any literature. So we discussed among ourselves. We have some reports that the cardiac toxic drugs they used to respond to ECMO, thinking that some of these cases are reversible. So we discussed among ourselves. We took the clearance, and then we discussed with the patient family to give an option to such patient. So this was the first case report in the world literature we tried on that day. The patient's cardiac output was less. This was X-ray, and this was subsequent after ECMO. We put the patient on ECMO, VA ECMO. Slowly the patient start recovering. At metabolic acidosis recovers within 6 hours after the patient was put on ECMO. The hemodynamic status, as this thing started sporting, and you know the improvement of metabolic acidosis, it starts improving. And the echocardiography showed improvement on 3rd day with ejection fraction of 35. The X-ray started cleared. This is the LV on 3rd day. The patient developed some complication, local complications, but the total duration of ECMO was 48 hours, and the total ventilatory support was 6 days. The patient was discharged on 3rd day. This was the first case with the 13th day of admission in a good condition. At 6 months follow-up, patient's LV function was normal. So I'm not going into detail of the rationale of ECMO. We know that there was some reversibility in alphos poisoning, so that's why this was given as an abridge. I'm not going to discuss detail in ECMO because this has been dealt already. But I'm going to show you a few of our experience. So this was our first experience of 7 cases where we were able to save 5 patients out of 7, and you can see very clearly most of the patients they came little late, and but the 2 patients that died and 5 were survived. The LV functions were very bad, and time of admission was our criteria was very stringent at that time. We took all those patients who used to die without any intervention. So we have found that the timely intervention with ECMO in patients with alphos poisoning with a severe metabolic and a refractory cardiogenic shock, there is some benefit with the ECMO, and the survival was almost 50%. So we took further this. Now we are offering ECMO to all those patients who fit into a criteria of ejection fraction of less than 30 with a metabolic acidosis, and patients who required at least 2 inotropes with full doses. And we know that this survival of these patients is almost uncertain or unknown, and so that's where we are offering those patients. And this was another publication we published in Indian Heart Journal of our experience of 15 patients, and we compare with the conventional group. We can see that the patients were a sicker lot in both the groups, and the pH was less than 7 in all, as it was our inclusion criteria. Ejection fraction was 27. The in-hospital mortality in ECMO group was 33%, and the conventional group was at 87%. There are, of course, the complications of ECMO, which we know that with the other learning curve, these complications are going down. To conclude, we can say that VA ECMO has been shown to improve the short-term survival of patients with alphos poisoning having severe LV myocardial dysfunction. A low baseline EF and a longer delay in hospital presentation are found to be the predictor of mortality. Naturally, the patient was on ECMO. Other patients never used to survive. So this is the experience till last year. There were total 35 patients of alphos poisoning with 60% survival. So in summary, I would say that alphos poisoning carries a very high mortality, we all know that, but VA ECMO is shown to be some good promising result as a bridge therapy. So these are currently, there are 2 patients when I left Ludhiana who were on alphos. One was a 25-year-old lady immediately after marriage, and this is another patient, young man of 35 years. It was an homicidal. Patient was kidnapped, and patient was given alphos mixed with alcohol. So these are the 2 patients who are battling on ECMO at present. Thank you very much.